Hello, this is John Kanellopoulos from our center here in Athens, Greece, the Laser Vision Ambulatory Surgery Center. We're going to go and see a very interesting cases that I encountered today. This is a 29-year-old gentleman who is diabetic. So he came in for his annual diabetic checkup. We can see that there's almost no diabetic retinopathy here. There's no microaneurysms. The vein to artery ratio, maybe 2 to 1 on the right eye, but on the left eye, slightly better. The vein to artery ratio 3 to 2, which is normal. Macula has this nice shiny appearance, no microaneurysms temporally. The reason we saw him was that in January, so about 2.5 months ago, he was diagnosed with a cotton wool spot on the left eye, right at this area. And this was a week after he went through COVID. Active infection. This was 3 weeks past his second COVID vaccination. She was vaccinated 3 weeks prior to contracting COVID. He contracted COVID after his second vaccine, and a week to 10 days later, he underwent, without any symptoms, his vision acuity is 20/20. His diabetes is in good control. His hemoglobin A1C is 6.4, and he was diagnosed back then with a cotton wool spot in the left eye. We're seeing the images from a colleague. This is not an Optos device, this is a composite from fundus pictures, and we can see here the cotton wool spot on the left eye, and we can see that very meticulously they did an OCT with sections here, and they caught that cotton wool spot in the left eye that had no visual repercussions. But with consultation with his diabetic physician, he was put on 80 milligrams of aspirin daily. And the question is, where do we go from now? On his same exams, these were from January of 22. We can see the date here, January 19th of 22. We're on March 30th of 22 today. We can see that what was missed on that exam is a massive cotton wool spot on the right eye. And this is way in the periphery. It's imaged here on the exams by our colleagues. Unfortunately, it was missed. Not that it would change the course of action, because just with the finding on the left eye, I think, and I agree, it was justified for him to undergo the aspirin treatment. And we can see here today that that cotton wool spot on the right eye has cleared quite a bit. It has left a ghost atrophy of the retina, but we can now see clearly that vessel that was covered up by the cotton wool spot. And I'm sure this is creating a scotoma somewhere temporally for this patient. This is a nasal aspect of the right eye. The macula, as I mentioned today, looks perfect. Maybe a microaneurysm here. His blood pressures, he had Holters, are generally normal. He runs 120/80, but he has peaked in non-exercise mode at 130/88. So his diastolic pressure is a bit high for a young 29-year-old male. And we're going to see in the Optos images today that there's really no leftover sign from his cotton wool spot that he had in January. 2 months and a week later, we can see though a macroaneurysm here, which was probably the source of that cotton wool spot that drove the attention back in January. So we're faced here with a patient that has very few diabetic retinopathy signs, maybe a microaneurysm here. So we have some beginning diabetic retinopathy at 29 with good glycemic control. So we have to make sure that the glycemic control is very good. We have to make sure that the blood pressure is very well controlled, because we know the combination of the two is very bad for the vessels, not only the eye, but the body in general, and possibly a complication from the COVID infection on somebody who was double vaccinated with a Pfizer vaccine and created an embolic episode. So in my opinion, I shared my opinion with his dietitian, excellent colleague from here in Athens, is to stay on a small amount of aspirin for at least a year, so 80 milligrams a day, have a thrombophilia workup, and maybe reevaluate the capillary potential dropout in his eyes a year down the line, and follow closely the blood pressure, more exercise, more austere in what is normal for this young patient as a blood pressure, especially the diastolic one. So we're shifting from my main focus, which is the cornea and keratoconus and refractive surgery. We're going more into medical retina here, but I thought I'd share what I consider possibly a COVID-related infarct in a young, healthy male that underwent asymptomatic COVID infection after his second Pfizer vaccine, and more things we learn from this pandemic, and more pieces of the puzzle and how they can affect the human eye. Thanks so much for your attention.